Hi, this is Dr. Rajeshwar from YR Pharma Tube. In the previous video, we learnt the historical development of local anesthetics. Hit the I button on top right of this video to watch it. For the other topics of medicinal chemistry, click on the links given in the description below this video. In today's lesson, we try to understand the chemistry and classification of local anesthetics. Local anesthetics are drugs that cause reversible local anesthesia and loss of pain. When they are used on specific nerve pathways, effects such as analgesia, that is loss of pain sensation, and paralysis, that is loss of muscle power, can be achieved. Thus, local anesthetics are medications used for the purpose of temporary and reversible elimination of painful feelings in specific or localized areas of the body by blocking nerve transmission to cause local loss of feeling and preventing muscle activity in the process without affecting consciousness. In simple words, local anesthesia is a technique to render part of the body insensitive to pain without the loss of consciousness. Local anesthetics are applied locally or injected to produce loss of sensation in the required area. The main site of action of local anesthetic drugs is the cell membrane. Local anesthetics decrease the permeability of cell membrane to sodium, thus prevent depolarization. Normally, the process is completely reversible and the agent does not produce any residual effect on the nerve fiber. Local anesthetics are used in many different ways and in various situations requiring local pain relief, beginning with simple procedures such as removing a small piece of the outer layer of the damaged skin to complicated operations such as organ transplants. They are widely used in clinical use for pain relief in situations ranging from dental and ophthalmological procedures to gynecological interventions. They are used for pain relief, soreness, itching, and irritation associated with the disturbance of the integrity of the skin and mucous membranes such as cuts, bites, wounds, rashes, allergic conditions, fungal infections, skin sores, and cracking. Significant improvements in anesthesia technique permit surgeons to do many procedures that previously required sedation and to perform surgical intervention without sedation just under pure local anesthesia, thus increasing patient safety and convenience. Chemistry of local anesthetics. All local anesthetics are synthetic compounds except cocaine, which is a naturally occurring compound. Clinically used local anesthetics are structurally either the esters or amides. Thus, both types of these anesthetics have three main structural units. They are an aromatic ring, an intermediate chain, and an amino group. Aromatic ring is the lipophilic or hydrophobic portion of the molecule. The aromatic ring is connected to the intermediate chain, which is also known as a linker, that may be either an ester or an amide group. This intermediate chain, which is variable in its structure, that separates the aromatic ring and the amino group of the molecule. The third unit is an amino group, which is an ionizable or hydrophilic group. The amino group may be either secondary or tertiary. The nitrogen of the amine group is linked through the intermediate chain to a lipophilic portion, that is the aromatic ring system. The amine functional group exists either as a neutral amine or positively charged ammonium cation depending upon the dissociation constant, that is the pKa value, and the actual pH value. The protonated local anesthetic possesses both a polar hydrophilic moiety, that is protonated nitrogen, and a non-polar lipophilic moiety, that is aromatic ring system. The pKa of typical local anesthetics lies between 7.5 to 9.3. An exception is benzocaine, which has a pKa around 3.5 and thus exists solely as the non-ionized base under normal physiological conditions. Ester anesthetics or ester-linked local anesthetics. Some ester types of local anesthetics are formulated with a preservative called aminobenzoic acid. Examples include procaine, chlorprocaine, benzocaine, cocaine, tetracaine, cyclomethacaine, dimethocaine, piperocaine, propoxycaine, and proparacaine. Ester drugs containing aminobenzoic acid should not be used if the patient is taking sulfonamide drugs, because One of the metabolites PABA, that is para-aminobenzoic acid, blocks the action of the sulfonamides and may lead to allergic reactions. They have been in use longer than amides. They tend to have a rapid onset and short duration of activity except tetracaine. Amide anesthetics are amide-linked local anesthetics. The amides have several advantages over the esters. In general, amide local anesthetics are less prone to allergic reactions than esters. Thus, amide drugs are the most commonly used local anesthetics. However, some amide drugs such as lidocaine and bupivacaine contain preservatives that can cause allergic reactions. It is important to be aware that the effects of amide drugs are addictive. Other agents of this class are articaine, cinchocaine, that is dibucaine, etidocaine, levobupivacaine, mepivacaine, prilocaine, ropivacaine, and trimecaine. Classification of local anesthetics. Generally, as discussed above, local anesthetics are divided into esters and amides according to their basic chemical structure. An ester is a chemical compound formed from the reaction between an acid and an alcohol. Amides are organic chemical compounds formed by reaction of an acid chloride, acid anhydride, or ester with an amine. Amides have lower incidence of causing an allergic reaction than esters. Local anesthetics are mainly classified into 6 major groups. They are: number 1, naturally derived local anesthetics; number 2, synthetic nitrogenous drugs; number 3, derivatives of acetanilide; number 4, derivatives of quinoline; number 5, synthetic non-nitrogenous agents; and number 6, miscellaneous agents. The subtypes and examples of drugs under each class have also been given in the figure. This is the structure of cocaine, which is a naturally occurring local anesthetic. Most naturally occurring local anesthetics, with the exceptions cocaine, menthol, and eugenol, are neurotoxins and have the suffix toxin in their names. Cocaine binds the intracellular side of the channels, while saxitoxin, neosaxitoxin, and tetrodotoxin bind to the extracellular side of the sodium channels. Here are the structures of benzoic acid derivatives. The various PABA derivatives have been shown here along with its subtypes, which are freely soluble and poorly soluble. These are the structures of the derivatives of acetanilide, or simply anilides. The two structures shown here are the isoquinoline local anesthetic drugs. The other two structures are benzyl alcohol and propanediol, which are synthetic non-nitrogenous compounds. Lastly, we have certain miscellaneous agents with local action. They are eugenol, phenol, chlorpromazine, and certain antihistamines, for example diphenhydramine. Pharmacological classification of local anesthetics. Based on the duration of action, local anesthetics are classified into short-acting, intermediate-acting, and long-acting drugs. The examples under each class have been given in the figure. We will study the individual classes of drugs in the upcoming lectures. Differences with local anesthetics. Local anesthetics are safer drugs, therefore, where possible, particularly in poor risk patients, they are preferred. Consciousness is not lost with them. With local anesthetics, usually functions of heart, lung, and liver are not affected. This is the list of references followed for the lesson. That's all in this video, the chemistry and classification of local anesthetics. In the next video, we will discuss on the structure-activity relationship and mechanism of action of local anesthetics. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.